Good day, viewers and listeners, and welcome to the COVID-19 update for today, March 30, 2022. I am Shania Gonzalez, and today Minister of Health Dr. Frank Anthony will be updating us on the multidisciplinary team set up at the Georgetown Public Hospital to deal with long COVID in Guyana.
First of all, COVID can be divided broadly in two phases. An acute phase, and now we are thinking about a long COVID phase or a chronic phase. So in the acute phase, which means when somebody get infected, they can either have a mild, moderate, or severe infection. And if they have a moderate or severe infection, more than likely they'll be in the hospital. So the acute phase generally would last for about a month. And then after that, most people would recover, but there's a group of patients that would continue to exhibit symptoms. And if those symptoms persist for an additional 2 months or so, those patients are then considered to be long COVID patients, or they have a chronic form of COVID. And doctors then would have to try to figure out what is going on with the patient. Now, one of the interesting thing with COVID is because it affects almost every organ in the body. Uh, these symptoms and signs that are presented during long COVID depends on the organs for that particular patient that is most affected. So that's why it's important to have different speciality come together to treat this patient because of the different presentation of long COVID. And we have been able to establish such a team of doctors at the Georgetown Hospital. So when patients are discharged, and if they have these symptoms, they can come back and they would be seen by doctors who are part of this team. And that's how we have been working so far with our long COVID patients. So, broadly, during long COVID, you can have two groups of symptoms, if you like. Some of the symptoms are what we would call physical symptoms, and others would be psychological or neurocognitive symptoms. The physical symptoms, the more common one is that people would complain of fatigue. Others would have a persistent shortness of breath. Others would tell you that they have a chest discomfort or tightness in their chest. Some of them will tell you that they have a cough. Others would have said that they have lost their sense of smell. So these are the kinds of physical symptoms that patients would complain about. In terms of the psychological symptoms or neurological symptoms, some people would tell you that they're having problems with their memory. They can't recall things, they can't remember things. Others would tell you they have problems concentrating. Some people would have anxiety, others would have depression. So these are all psychological symptoms, and these things persist for months. And it can start affecting the person's quality of life. And I guess when that happens, that's why a lot of persons will return to the hospital to find out what is going on with them. So if anybody who's listening, they know a patient with these types of symptoms, they don't have to wait and think it's normal. They should come and consult with the doctors at the hospital so that they can make a diagnosis and determine whether it's part of a long COVID syndrome or maybe it's something else. So right now we have for adults, we have 438,123 uh, first doses administered to persons 18 years and over. That's approximately 85.4% of our adult population. Second dose, we have 336,695 doses administered. So that would move us up to about 65.6% of our adult population. In terms of persons 12 to 17, we have completed 34,301 doses. That's 47% of that age cohort. And we have completed 24,988 doses. That's 34.3% of that age cohort. Booster doses are now at 58,132 doses.
You have been watching the COVID-19 update for today, March 30, 2022. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. I am Shania Gonzalez saying goodbye.